Hello guys, I am Samkit Jain, a medical student at Vinitsa National Medical University, and I am an inspiring mind student, and here I am back with a new video of my anatomy series with the topic median nerve, its path and its related injuries. And guys, I'll continue to bring such amazing videos for you. For that you can subscribe to our YouTube channel and follow us on Instagram at Inspiring Minds Coaching. You can also join our Telegram channel for better revision of the topics. All the links will be provided in the description below. Now let's start with the video. So what actually is median nerve? As we discussed in the brachial plexus, that median nerve is made by two roots, the lateral root and the medial root. The lateral root of median nerve will be coming from the lateral cord of brachial plexus, while the medial root is coming from the medial cord of brachial plexus. Both these roots will combine to form one median nerve. Therefore, the root value of median nerve is from C5 to T1. This is the root value of median nerve. Now median nerve will start its supply after the elbow only. Once it reaches the elbow, then only it will start supplying the muscles. So let's see. Suppose that here is your humerus, the lateral and medial epicondyles of the humerus. Right now, median nerve, once it crosses the elbow, it crosses the two heads of your pronator teres muscle. It crosses the two heads of pronator teres muscle and also supplies them obviously. While after crossing the pronator teres muscle, it gives off a branch that is known as anterior interosseous nerve. Anterior interosseous nerve, that is AIN. In the last video of radial nerve, I discussed that radial nerve was giving posterior interosseous nerve, but here we have anterior interosseous nerve. So anterior interosseous nerve is the continuation of your median nerve. Now what does this anterior interosseous nerve do? It supplies all your deep flexors, that is flexor pollicis longus. Okay, it has the job to supply all your deep flexors like flexor pollicis longus, pronator quadratus and flexor digitorum profundus. But the important point here is that anterior interosseous nerve will supply only the lateral half of flexor digitorum profundus. It won't supply the medial half. The medial half of this muscle is supplied by the ulnar nerve. So if there is any injury to the median nerve that involves the flexor digitorum profundus, therefore in that case only the lateral half of this muscle will be affected. The medial half will be spared. Now the main branch has the responsibility to supply the superficial flexors. Anterior interosseous nerve, which was a branch of median nerve only, was supplying the deep flexors, but the main branch, that is the median nerve itself, will be supplying the superficial flexors. So it is supplying the superficial flexors. And one name that I would like to mention here specifically is flexor digitorum superficialis, as we need it in injuries when we'll discuss injuries. Now, after all this, flexor digitorum, after all this, the median nerve, it passes deep to your flexor retinaculum. It goes deep to your flexor retinaculum or carpal tunnel, and after crossing the flexor retinaculum, it gives off a lateral branch and a medial branch. It gives a lateral branch and medial branch. So here it crosses the flexor retinaculum, then it gives off a lateral branch and a medial branch. Now this lateral branch will supply your first lumbrical. We have four lumbricals, L1, L2, L3, L4, but in this the lateral branch of median nerve will be supplying the L1, that is first lumbrical only, whereas the medial branch will supply the second lumbrical. The rest two are supplied by the ulnar nerve. So this is the lateral branch of the median nerve. This is the medial branch. Now this lateral branch will further give off a recurrent branch. It will give a recurrent branch. So this is the recurrent branch. And this recurrent branch will be supplying all your thenars, all the thenar muscles here in this region, the muscles in this region, the muscle in thenar eminence. It will supply all the thenar muscles except one muscle, except adductor pollicis, because this adductor pollicis is again supplied by ulnar nerve. So it will supply all the thenar muscles except adductor pollicis, and this median nerve will further give off a digital branch. What does this digital branch will do? This digital branch will supply the lateral 2.5 or 3.5 of the digits of your digits on the palmar side, not on the dorsum but digits on the palmar side. And median nerve will further give off a branch, will also give off a branch, that is palmar cutaneous branch. This is palmar cutaneous branch, and as the name suggests that it is a cutaneous branch that will supply a palm. What side of palm? It will supply the lateral 2.5 or 3.5 of your palm. So lateral 2.5 or 3.5 of your palm was supplied by the digital branch. Your digits. Lateral 2.5 or 3.5 of digits was supplied by the digital branch, whereas lateral 2.5 and 3.5 of your palm are supplied by the palmar cutaneous branch. And the important point here is that this palmar cutaneous branch, it does not comes deep to the retinaculum. It comes superficial to the retinaculum. Now let's see that what are the injuries related to the median nerve. Let's say that there are 2 points of injuries. One is here, the higher point, let's call it as A, and the other one is here, B, that is inflexor retinaculum or carpal tunnel. Right, now let's see that what occurs when the injury is at a point A. Here you can see that entire median nerve is gone. If injury is at A, entire median nerve will be gone. Therefore, what will be the manifestations? For that, let's see an image over here first. Okay, so this all is about the injury at A, that is upper median nerve injury, that may be due to your supracondylar fracture, or there may be Struthers syndrome. There will be pronator teres syndrome. What is pronator teres syndrome? Since median nerve crosses the two heads of pronator teres, therefore it may be compressed in between two and cause certain manifestations. So that is known as pronator teres syndrome. Now what happens in the upper median nerve injury? Now, as I said, your flexor digitorum superficialis will also be gone. Okay, first you will ask a patient to make a fist like this. Now, can a patient make a complete fist in a median nerve injury? No. What will happen since your flexor digitorum superficialis is gone? Therefore, the patient won't be able to flex your second, third, fourth and fifth digits. Your first digit, that is your thumb, will also not be flexed. Why? Because flexor pollicis longus is also gone. Flexor pollicis longus gone, thumb won't be flexed. Next, flexor digitorum superficialis is gone, all these digits won't be flexed, but flexor digitorum profundus of the medial side is spared. Flexor digitorum profundus of only lateral side is gone. Therefore, patient won't be able to flex your second and third digits. But patient can flex your fourth and fifth digits he or she can slightly flex with the help of the medial half of the flexor digitorum profundus, because it is not supplied by the median nerve. So patient won't be able to flex the thumb because flexor pollicis longus gone. Patient won't be able to flex your second and third digits. Why? Flexor digitorum superficialis and lateral half of flexor digitorum profundus is completely gone. But patient will be able to flex fourth and fifth digits because flexor digitorum profundus, the medial half of flexor digitorum profundus is left. But this flexion will be a weak flexion. So here you can see that patient is not able to flex these. So no flexion of thumb, no flexion of index and middle fingers. Why? Because both flexor digitorum superficialis and lateral half of flexor digitorum profundus are gone, but patient will be able to weakly flex. There will be weak flexion of fourth and fifth digits. Why? Because flexor digitorum profundus, the medial half is spared. And one important point here, that in any median nerve injury, one important feature is there: the patient won't be able to do opposition of the thumb. This is known as opposition of the thumb. In any median nerve injury, there will be no opposition of thumb, and inability to do this action, inability to oppose your thumb, is known as ape hand deformity. Therefore, there will be ape hand deformity. Ape hand deformity is a must. That is inability to perform opposition of thumb. Ape hand deformity is a feature of any median nerve injury. And the ability to flex, though weakly, but the ability to flex your fourth and fifth fingers, fourth and fifth digits, is known as hand of benediction. This is known as hand of benediction. And since your index fingers, you can see it is more pointed, your index finger is quite more pointed, therefore it is also known as, this condition is also known as pointing index finger. So hand of benediction or pointing index finger. Now along with this, what will happen? We have some cutaneous branches also. So along with this, in upper median nerve injury, there will be loss of sensation. There will be loss of sensation from lateral 2.5 or 3.5 of your palm. There will be no sensation over this region. Similarly, there will be no sensation on lateral 2.5 or 3.5 of your digits. No sensation over here, since digital branch is also gone and palmar cutaneous branch is also gone. Plus, in the last video I said that median nerve also supplies the nail beds on the dorsum of your hand. So these nail bed areas, there will be no sensation over here. Right? Now, what happens in case of lower median nerve injury? Alright, so lower median nerve injury. Now say the median nerve is injured in the carpal tunnel. Now what will happen? In carpal tunnel, first of all, if median nerve is injured in carpal tunnel, this condition is known as carpal tunnel syndrome. It is known as carpal tunnel syndrome. Now what happens in this syndrome is that first of all there will be no hand of benediction. That is, patient can make a complete fist because of flexor digitorum superficialis, profundus, flexor pollicis longus are spared. Therefore there will be no hand of benediction. Patient can make a complete fist. A complete fist is present. Now, so what will be the manifestation? What will happen now is that, since you can see that your digital branch is gone, therefore there will be no sensation on the lateral 2.5 or 3.5 your fingers. There will be no sensation on this area because the digital branch is gone, plus your palmar cutaneous branch is spared because it is coming superficial to the retinaculum. Therefore, there will be no sensation loss on the palm. The sensation loss will be only on the will be only on your digits. So there is sensation loss on your digits because the digital branch is gone, but no sensation loss on the palm. And since your median nerve is also supplying the thenar area, therefore there may be atrophy and flattening of thenar muscles. Plus, here we have a sign that is known as positive Tinel sign. What is this Tinel sign basically? In carpal tunnel syndrome, when you tap the median nerve in your carpal tunnel, there is tingling appearance on entire course of median nerve, right? Wherever the median nerve is spread, there will be tingling over there in carpal tunnel syndrome. This is known as tinel sign. So in carpal tunnel there is positive tinel sign. So this was about the median nerve and its injuries. Okay, now we can also infer from all these points that suppose a patient is not able to do interphalangeal flexion of the thumb, then which nerve will be gone? Which nerve is gone? It is anterior interosseous nerve, because it is supplying the flexor digitorum profundus. It is supplying the flexor pollicis longus. Therefore, the patient will be able to do the interphalangeal flexion for the thumb. So this was about the median nerve, its path and its various injuries. And for more such videos, you can subscribe to our YouTube channel, and if you have any doubt, you can just comment below in the comment section, and I'll try to reply all of them. Thank you so much, guys.